haram, right? Basically, in the end,
Takbir.
you guys are quiet, folks. It's not that serious, you know what I'm saying? You must have eaten something.
Matter of life and death.
It is a matter of life. So, we basically, for those who've seen it, you know, you push on the chest, you're supposed to breathe into the mouth of the patient, you don't have to do that anymore. Basically, it's all about doing compressions into the chest, calling 911, and then we also have what's called the defibrillator here, and it's called an AED, okay? So the reality is that we do find masajid who kind of don't understand the concept and the purpose of it. Do we want to save someone's life? The answer is yes. And it's just, I think it's just human nature, right? I understand as Muslims, we're like, you know, qadarullah, kulli shay maktub, everything is written when you're supposed to die, but maybe when you're supposed to help somebody, and you're supposed to help somebody as well, right? I'm assuming that, because we're going to learn about how to relieve choking, I'm assuming that if someone was choking, right, and they're only 25, or they're young, or only 55, we want to save them. Is that a fair statement, right? So we want to learn those skills, inshallah, so we can basically, you know, help somebody. For those who are in the khutbah today, as I mentioned, you know, we have different ailments and injuries and things that happen to us. The leading cause of death for adults is what we call cardiac arrest. It's not a heart attack. A heart attack will lead to cardiac arrest. But a heart attack basically is when someone has, you know, they're having chest pains, they're having trouble breathing, and then cardiac arrest is when they finally collapse, okay? So we're certified with 3 different organizations. We're certified with the American Heart Association, we're certified with the American Red Cross, we're certified with the Health and Safety Institute. We will be using this platform. Generally speaking, it is a video-based class. However, we are here to not interrupt, but to integrate my experience and answer questions for you. We have mannequins that we will have you work on. If you have any questions about first aid things, I did bring my first aid bag. If we have some time, I will cover it. Your questions are way more important than what I have to say. I've been teaching this class for 20 years, and sometimes my mind goes somewhere else while I'm talking, and so I might forget where I'm at, so maybe somebody can help me. Maybe the younger folks can help me remember. Yes? All right, so this first video, I hope, Azad, I don't know, the volume's all the way up, so I don't have a remote. Do you have a remote in case we can get it turned lower? It's at 100% with the volume. So this first thing, and I don't know this, apparently I think he's streamlining it, aligning it. So if we need to move the camera, we will, right? I don't know how much you're gonna see, but whatever. This first video is basically like a video to say, hey man, we want you to take action, okay? You know, I didn't, you know, as Muslims, you know, Allah subhanahu wa ta'ala, He says, إِنَّ الَّذِينَ آمَنُوا, and then after that is always what? Any place in the Quran you're going to find الَّذِينَ آمَنُوا, those who believe, they do the action, right? So the idea is that you actually do something. And sometimes we're not sure, like, we'll actually do something. Will I really do this, and will I want to do this? We have this thing in our brain called the autonomic nervous system. Autonomic nervous system, you don't know how you're going to react, right? You don't, it's called the fight or flight. Someone breaks in your house, and you like run, or you fight. You're not really sure which one you're going to do unless you're trained all the time. That's why we have the military and police, fire department, all these different organizations that train and train and train and train. So when the incident happens, they're ready to draw their weapon, they're ready to fight the fire, they're ready to help somebody, those type of things. Does it make sense? All right. So sometimes you don't know what you'll do, but the whole purpose of this course is to encourage you to do something. I have been in masajid where we've been praying, and someone will collapse, and no one will do anything, and think that their prayer is more important than the person's on the ground. I'm not a sheikh. I know enough from talking to the imams that it is permissible to break your prayer to help that person. Okay? I've been in a situation where a sister passed out. Sister passed out. It was during Tarawih. It's not an obligatory prayer. And basically the guy said, okay, just keep on going for the next 2 rakats. Started doing the next 2 rakats. While we went upstairs, all the sisters stepped back. We all started praying. The fire department shows up. The Quran is being recited. And I'm feeling very awkward at that time because we're supposed to just be Muslims and just let our people just pass out and do nothing. Okay? So we want you to take action. This video is literally, you know, it's got the music in the background to make you feel all warm and fuzzy inside that, hey, you're going to go do something. So let's watch it. It's a little loud. We'll talk outside for a minute.
happen anywhere at any time. Thousands of workers die on the job, and millions of
Some people
workplace
can't hear.
injuries and illnesses occur in private industry every year.
For sure.
There are over 100 million emergency department visits in the United States annually, 35 million for injuries
Some of
alone.
the volume is too loud.
While some of these injuries and illnesses can be treated, prevention of illness and injury is always better. A healthy lifestyle, combined with a commitment to safety at work, home, and play, can prevent many needless disabling injuries, illnesses, and deaths. However, once an injury or sudden illness has occurred, effective first aid can save lives, prevent permanent disability, and improve recovery. Trained first aid providers have a vital role in delivering this care during the first minutes of a medical emergency, before emergency medical services or EMS providers arrive and take over. This course is intended for individuals who desire or are occupationally required to be trained in first aid for adults and/or conventional cardiopulmonary resuscitation and automated external defibrillation for the adult, child, and infant. The purpose of this training program is for participants to gain or improve knowledge and skill proficiency in adult first aid and/or conventional CPR and AED. First aid is the initial care provided for an acute illness or injury. The goals of first aid include preserving life, alleviating suffering, preventing further illness or injury, and promoting recovery. First aid can be initiated by anyone in any situation, including self-care. A first aid provider is someone trained in first aid who can recognize, assess, and prioritize the need for first aid, as well as provide care by using appropriate skill competencies. A first aid provider recognizes their own limitations and seeks additional care when needed. Conventional CPR is an emergency procedure that combines chest compressions with artificial ventilation to circulate oxygenated blood to the brain and heart, increasing the possibility of successful resuscitation. It is performed by a trained CPR provider. A first aid provider may or may not be trained in conventional CPR, and a CPR provider may or may not be trained in first aid.
Okay, sorry about that. Okay, so there was a couple things on here. We'll talk about it again. They spoke about limitations. They spoke about CPR only. When you do CPR, right, the compressions on someone, a lot of times we see that people have pinched the nose and they breathe into the mouth of the patient. You've seen this before? Okay, yes, you're not required to do that any longer, just to make sure it's clear. They're going to talk about it, they're going to show you all these things, but you're not required to do that any longer, just to make sure it's clear. Regarding limitations, I'll talk about that a little later, but I want to make sure that you know that there are some legal concepts when you perform or before you do CPR, okay? In other words, if you hit somebody, do you have to do CPR? If you're in child care and the child are there for you, do you have to do CPR? You've been certified but no one knows, do you have to do CPR? You started talking to the patient and the patient doesn't want your treatment. Do you have to help them, or should you still help them? Can you walk away from somebody after you started to talk to them? Can you do things that you've seen on TV that we're talking in this class, that we're not talking about that, but you say, well, they did it on Grey's Anatomy, I'm going to probably do it, I'm going to do that. There are things you can and cannot do, which goes under the umbrella of legal concepts. Let's watch this, and then I'll explain, okay?
There are relevant legal concepts that all first aid and CPR providers need to be familiar with. Duty to rescue is a concept in law that refers to the duty of a person to rescue another who is in a dangerous situation. In the U.S., in general circumstances, there is no duty to rescue. A person cannot be held liable for doing nothing while another person is in peril. However, there are certain situations where a person may have legal duty to provide aid to an ill or injured person. For example, the driver of a vehicle involved in a crash resulting in an injury or death of any person would have that duty. Some people, by the nature of their occupation, have legal duty to provide first aid. This includes firefighters, law enforcement officers, lifeguards, school teachers, and others. A Good Samaritan is defined as one who voluntarily renders aid to another in distress, although under no duty to do so. All 50 states and the District of Columbia have statutes that provide immunity from liability for people who assist others, called Good Samaritan laws. They are intended to encourage people to help others in an emergency without having to worry about being sued. Good Samaritan laws generally apply to any person who voluntarily comes to the aid of an ill or injured person and acts as an ordinary, reasonably prudent person would have acted under the same or similar circumstances. Although these laws vary from state to state, they typically require these circumstances to apply. The situation is an emergency. Any aid is voluntarily given. The victim must give consent whenever possible. The aid must be given free of charge and in good faith. The aid cannot be grossly negligent. Grossly negligent means a lack of care that demonstrates reckless disregard for the safety or lives of others, which is so great it appears to be a conscious violation of other people's rights to safety. It is more than simple carelessness. To provide first aid care for someone in an emergency, you must have their consent, meaning their approval or agreement.
Oh yeah, please help.
Okay. Consent comes in two forms, expressed or implied. Expressed consent can be given verbally, in writing, or non-verbally. For example, when a person nods their head to agree when asked, "May I help you?" Don't touch or give first aid to a conscious adult who objects to it. Consent is implied when circumstances would lead a reasonable person to believe that consent would be given, but it was not directly expressed. Implied consent in an emergency usually occurs when you're unable to communicate with a person, such as if someone is unresponsive. The assumption is that they would ask for help if they were able to. Employers are legally obligated to keep certain employee records private. For example, the Americans with Disabilities Act requires employers that have disability-related medical information about an employee treated as a confidential medical record. However, this information may be disclosed to first aid and safety personnel when appropriate, if the disability might require emergency treatment. If you learn confidential medical information in your role as a first aid provider, it is your responsibility to keep it confidential. To be abandoned is to be left without needed protection, care, or support. Although there is generally no duty to rescue, once you decide to help, you should not abandon the victim. Stay with them and continue to care for them until someone with equivalent or higher training takes over for you.
Okay, any questions about legal? I got a couple things I'm gonna cover. What are the two types of consent? This is which thing, so he's asking me that, but that's. What are the two types of consent? Yes? Express and implied. Very simple, straight to the full point, right? Literally, when you walk up to someone, it sounds kind of weird or kind of quirky, like, hey, I'm first aid, can I help? Right? It sounds like but it's something that you do want to say. Does it make the person feel more comfortable that you can help them? The answer is yes. When I was a paramedic, we would show up at people's homes, and they might look at us and say, "Are you a doctor?" And we're not doctors, right? We're paramedics, right? But we're there to help them and get them to the hospital, right? So you do want to ask them. And of course, implied means that if they're unconscious, if they had a few seconds to wake up, they would wake up and say, "Can you please give me a hand?" Does that make sense? So there's an idea, and the question comes, what happens if, this came up the other day, what happens, and as a matter of fact, some of the folks who work for me, they said, hey man, and this has happened to some degree, because when I was in the fire department, I've been retired for 7 years, and so what happens when do we have, not just Muslims, but just from a cultural or religious perspective, where women don't want to be touched by men, right? So the question is, we show up for the sisters. You would prefer a woman to help you? Is that a fair statement? Well, what happens when it's not? Because it's pretty much a male-dominated job, right? So then what? So the question was coming up recently, which is, what if the sister is choking, specifically a Muslim sister, right? And of course they have this skewed idea about men in Islam, like the husband said, "You can touch my wife and let her die," or whatever, right? Which ideally that's not the case, right? I'm not giving a fatwa, but I've been around long enough to talk to the imams. That it's permissible for someone to help you, even if it's male, right? But what happens if they say, "Don't touch my wife," and now she goes unconscious? Is it now considered implied? Or what if she says, "I don't want you to touch me"? She verbally says, "I'm not consenting," and then she collapses. It doesn't matter religion, anything like that. Then now is it implied? I'm not a lawyer, I don't know the answer, but I think it would be implied at that point, right? I'm a person who's always gonna do the right thing first, right? All these legal things kind of get in the way, even when we're in the fire department, all right? So just make sure if you can. Do I think, is that a common occurrence? The answer is no. Usually the person will say they'll take your help. There are times, there was one time when I was working in Potomac, very old elderly woman, she was on the ground for, I don't know, almost 24 hours in her house, and so it was safe, but she was on the ground in one position, couldn't move. We finally get her up, slowly get her onto the couch, and she says, thank you. Thank you, you have to go with us. No, I'm fine. So then I have to try to talk to her. Can she legally refuse transport? She's conscious, she's sane, she's an adult, she understands, but she's been in a position, she needs to get checked out. So I have to go, if you were my grandmother or you were my mother, I have to speak to her gently, and then finally she went with us. Because inevitably these people are gonna call back, right? So you have to make that decision. We've had people as well. What if the person says, if I say, Rashid, look, let me just call the hospital, call 911. And you're like, no, okay, I'm okay. But I can see like there's something sticking out of the back of the, I'm like, no, let me call. And you're like, no. He said, let me call. And then when they get here, let them look at you and so on. So you want to do your best to get the professional help there and take the liability off of yourself. Does that make sense? The other thing is negligence and abandonment. So if you start, first of all, I guess it doesn't matter which one I start with. Negligence is something that you do to someone that you're not legally able to do. And I say the joke where it's, hey, if you see it on TV, and people do see things on TV and think it's okay to do that, right? You cannot do that. Whatever we're teaching you here today, that's what you're allowed to do, otherwise you cannot do that. Okay, is that clear? If I start to, Habibi, sorry, what's your name? What's your name?
Ninja.
Ninja?
Yeah, ninja.
Ninja. Oh man, I like that name. If I walk up and I touch him and I say, hey, can I help? And I start talking to him, and then I realize I'm late for Salah and I gotta go, that's called abandonment. That means I was talking to him, I was working with him, I was trying to help him, and I just left him by himself. And now he's on the ground, but they say, well, we saw Amer with him the last time. Could I have hurt him? It's possible, right? Probably not, but in the end, you can't just leave somebody. Once you engage with them, you can't just walk away. Is that clear with everything? The last thing, question? Yes. Go
Yeah,
ahead.
I had a question, something like mistaking a seizure or some other disorder from if a person choking or having a heart attack, because sometimes you see people, they're in some kind of crisis and you don't know what it is.
Sure.
Is it safe to try CPR or just call for help?
No problem. So what we're going to do for this class is that we're going to go through the process of walking up, checking on someone, checking the scene, checking the responsiveness, checking the breathing, and so on. What I want to make sure is clear is that you don't want to, and I don't even like to use this word when I say diagnose, it does not matter how the person ended up unconscious. If they are unconscious, and when we say not breathing, just basically not responding, those type of things, then we do the same process. It doesn't matter if they were asthmatic, a heart attack, a diabetic, a diabetes, it doesn't really matter. They're on the ground, they're in a chair, they're passed out, whatever the case may be, we're gonna go through the same process. Just to make very clear, seizures, people are still conscious. When I say conscious, let me rephrase that. People still have a heartbeat and they're breathing, all right? We do not do CPR on someone who's had a seizure. Is that clear with everybody? Just as a quick side note. Otherwise, if they're not, I'll say this now. If a person is not their norm, if they're not their normal self, right? In other words, if you all know each other because you come to Fajr, you come to Isha, and so on, and you know each other, and you don't have to know someone very long to know that but if they're not their normal self, that means if they turn pale. So I've been with you all for about 15 minutes. I pretty much can see real quick what skin color is and this type of thing. But if you start to turn pale and I see you, that's not normal. Do I know what the problem is? Maybe you didn't eat. Maybe you have diabetes. Maybe, who knows what the situation. Maybe the video was showing you maybe you had a relative that died and now it's affecting your mental state. It's possible. It has happened in my classes. So if your job is not to figure out, oh, well, let me see, okay, blood pressure, pulse. Forget that. They're not the norm, call 911. Okay, especially, and of course we're going to take it all the way to the point where you have to do compressions. Is that clear? Yes.
We have an online question. So how do you deal with people disabled?
Disabled people?
Yeah, maybe they can't communicate.
Yeah, so you do have disabled people, folks. So right, whether it's I'm not going to, let's say someone who's blind can speak. Okay, that's fine. They can verbally say something. Someone who's deaf might have a different challenge, right? Those type of things. You have someone in a wheelchair. I will answer it the same way, I think. If you find someone who is not there and you don't know, here's what I would tell you. The idea of just knowing someone is breathing and having is unconscious, I would say, okay, cool, they're okay to me right now. I always, like, one of the things I say about like infants, I always say a crying baby is a good baby except for 3 o'clock in the morning, right? Keeping you up all night, right? So if a baby is crying, I can hear their vocal cords, that's good, okay? But if we have someone who's in a wheelchair, and especially if you have someone who takes care of them, your reference point is going to be asking that person, is this their normal self? Is this how they normally act? Those things. When we find someone who is disabled by themselves, it's very possible. For those who don't know, my daughter is a sign language interpreter. She has not dealt with, but has studied a little bit enough to, you have people who are deaf and blind. How do you deal with that? How do you know? How do you know if they're just feeling sick, right? Even if they're not able to speak or they can't hear, they're standing or they're sitting. Can you just check by breathing? I look, I can't barely tell if he's breathing because his shirt is baggy. I can't tell for the sisters for sure. Or how do we know someone's breathing? So that's part of the assessment that we're going to see here in the next couple slides. I hope that answered the person if they want to clarify, if they want me to clarify. But assessing, trying to see what's going on, taking your time, seeing what's going on with the patient is going to be key. It's going to be vital to deciding what you want to do. So you'll see it, I'll do it now, but one of the things we'll check, we'll walk up to the patient, we'll tap them on the shoulder really hard. Hey, can you hear me? Can you hear me? No response, I'm going to check for breathing. If he's breathing, there's no need for me to move him onto the ground and do compressions. If he's not breathing, where does he go? He goes onto the ground. So that's an assessment thing like that I can do. But if I'm looking at him and he's talking and he's kind of like this, well, he's technically still conscious. Just because he's kind of like this doesn't mean I start pushing on his chest, right? So same with someone in a wheelchair. Of course, each situation, it's always going to be situational, by the way. It's never the same, period, okay? One other thing I wanted to say, I hope I answered. The other thing I wanted to say was towards the end, they were talking about it's called privacy and so on. So usually I'll speak about this in a setting which is an office and so on, but here's what I would say. Here in a masjid, we know each other, right? But there are people who are private. Do we know that someone has asthma and takes an inhaler? Do we know that someone uses an EpiPen and so for allergies? Do we know that someone takes nitroglycerin for heart attacks? We may not know that, and we could have been paying next to the brother for how long? Everybody knows his eye? Yes? Anybody know his ailments? Anybody knows if he has anything? He's not going to send a blast email and say, hey guys, this is what's going on.
Only speaks too much.
Yeah. Speak too much. Y'all hear that on camera? No, but that was good. Sorry, don't worry, you don't be able to. In the end, right, so he might tell a few of the brothers, hey, listen, I'm a diabetic. If something happens, I have some glucose pills or whatever. Or I'm allergic to bees, if I ever get stung by bees, there's EpiPen. I'm not saying you have to broadcast it, right, because there is this idea of the HIPAA law and all that stuff, which is not really when I say it. I mean, it's fine, it's a law, right, but in the end, if you want to be saved, when I say saved, you know what I mean, like if you have an ailment that's going to, if you get stung by a bee and you know you're going to have trouble breathing, but no one knows you have an EpiPen, and you carry it on by yourself, that doesn't do any good when you get to the point of, and you try to tell someone that you have an EpiPen in your purse or in your bag, it just doesn't work, right? Well, I'm not telling you, don't send a blast email to everybody and say, this is my ailments, I sit in the front row of the massage, I pray for you and Isha. If anything happens, come save me. You don't have to do that. Maybe you might tell a couple brothers here or there. Okay? Is that clear? So, the Good Samaritan basically says, as long as you don't have any bad intentions to hurt somebody, no ill will. And that's the beauty, like as Muslims, we get to talk about this stuff. What is an intention? Right? It is by your intention. By your intention, your actions are based on your intention. No one knows your intention. So it's very interesting they use this, because in the end, as long as you have good intentions, inshallah, you should be held liable for anything. Okay? Make sense? All right, so which brings you to roles and responsibility. What are you supposed to do? So if there are, and it's usually the case, it's kind of almost even, mashallah, but usually we have a lot of sisters who show up more than the brothers. But if the sisters here now understand the concept, and then tonight some male protector, some sister like passes out or something happens, do the brothers have to go back to the sisters? The answer is no. So you can know your role, your responsibility. But if there's a doctor, or even for myself, a retired EMT, and you feel comfortable to come get me, then I can play a different role and so on. Does that make sense? All right, so let's watch this quick video. It's about a minute and a half.
A trained first aid provider must be able to recognize, assess, and prioritize the need for first aid. Doing so requires being able to recognize life-threatening conditions. There are situations where time is of the essence, and delays can lead to serious, even fatal consequences. Life-threatening conditions include unresponsiveness, severe external bleeding, shock, altered mental status, difficulty or no breathing, choking, stroke, and chest pain or discomfort. Other warning signs and symptoms of a life-threatening condition include coughing or vomiting blood, persistent vomiting, head injury, seizures, poisoning, severe allergic reaction, or major broken bones. Recognizing the signs and symptoms of a life-threatening condition and taking quick, effective action can potentially save the life of a loved one, a colleague, a stranger, and maybe even yourself. A trained first aid provider must provide care using appropriate skill competencies. Skill competency in first aid is the ability to use first aid knowledge and skills confidently and effectively. Learning, practicing, and using step-by-step procedures for handling life-threatening conditions will help you develop competency in first aid. Recognizing your limitations means acknowledging the limits of what you know and what you can do. Failing to recognize your limitations has the potential to cause harm. A first aid provider should never go beyond the knowledge and skill competence they have learned and demonstrated in training. Know your limits and seek additional professional help when needed.
Okay, so a couple things about this video. First and foremost, I'll just start where they ended. I said earlier, just you have to know your limits. When I say you know your limits, if you don't like blood, and someone says, oh, someone just fell and there's blood everywhere, don't you feel like, hey, and you walk down the stairs and say, what happened? And then you collapse. Does that make sense? If you need to do compressions, and if you want to help you do compressions, and you just hurt your arm, or it's in a sling, whatever the case, you could be the person calling 911 and not actually doing the compressions. Is everyone with me? Okay? So just make sure you know your limitations, whatever those limitations may be. The other thing they spoke about was serious life-threatening conditions. Can someone tell me, just rattle them off? What were some of the life-threatening conditions that you saw? Or which is one? Unresponsive. What else? Coughing blood. Stroke. Choking. Shock. Fainting. All right, very good. Seizures. We're not going to remember all of those. I'm going to go back to what we were saying a little bit. If the person is not their norm, don't worry about the list. Don't worry about trying to figure out what it is. You just call 911. And the reason I'm emphasizing 911 is that the liability that you want to not take off your shoulder like you're so concerned, but you need that help. CPR, meaning the compressions, and 911 are equal. When I say they're equal, meaning that if you don't call 911 and you do CPR, that means you're by yourself for a long time. And if you do call 911 and, which one did I just say? If you do the opposite, let's put it that way, right? If you do CPR and you don't call 911, you're by yourself a long time. If you call 911 and don't do CPR, then it's not really helping the patient. Is that clear with everyone? Okay? Now, which brings us to, and I'll talk about a little bit more about the roles and responsibilities, which brings us to the assessment. This is the longest video, it's about 11 minutes, okay? I do want you all to watch this. Some of it's a little kind of like mundane and so on, but it gives you an idea of what's happening. But I want to tell you, they talk about putting on gloves, they do talk about washing hands, but you're gonna see, and I'll show you this, I'll put this up here now, and I'll go back. You're gonna see this process here, okay? This process here, all right? You see that, sisters? Okay? I don't know if I'm jacking you out.
It's fine, it's fine.
So, but let me go back. So let's watch this assessment video. I wish I could make it a little shorter. I just want to make sure, because I know that I want to get you onto the mannequins. I need to still talk about choking for the adult, relief choking, all that other things. Okay? Is it? Sorry. Oops.
First aid and CPR providers should follow established procedures for first aid, CPR, and AED. This step-by-step guidance for performing first aid and CPR is based on scientific evidence, national guidelines, and the consensus of experts. There are different procedures for first aid and CPR depending on whether the person affected is an adult, child, or infant. The action you take also depends on your training as a first aid provider, a CPR and AED provider, or both. As such, the procedures you will learn in this class depend on your first aid, CPR, and AED training needs. When an emergency occurs, it may not always be clear at first what kind of care the person needs. If you are a trained first aid, CPR, and AED provider, you will follow that procedure. If you are only trained in first aid, you will follow that procedure. These procedures list actions in sequence, but in a real emergency, they may need to be carried out in a different order or performed simultaneously when multiple providers are available. Although there are separate procedures for first aid, CPR, and AED, the first steps are always the same. There are 5 main elements to the procedure for first aid, CPR, and AED. Assess scene safety, take standard precautions, assess responsiveness, activate EMS and/or your emergency action plan, send someone to get the first aid kit and an AED, assess breathing for no more than 10 seconds. Emergency scenes can be dangerous. Your personal safety is the highest priority even before the safety of an ill or injured person. Always pause for a moment before approaching. Look for obvious hazards and consider the possibility of hidden dangers. If the scene is unsafe, do not approach it. Activate EMS or your emergency action plan. It is best not to move an ill or injured person at all, especially when you suspect a spinal or pelvic injury. You should only move a victim when there is an immediate danger and you are able to take action without placing yourself at unreasonable risk. If you decide it is necessary to move someone, the most effective emergency move is a drag. When using a drag, pull in the direction of the long axis of the body to keep the spine in line. Never pull a person's head or pull a person's body sideways. Use your legs, not your back, and keep the person's weight as close to your body as possible. Avoid twisting. Consider if you can safely move the person based on your physical ability to avoid hurting yourself. Common drags include the extremity drag, performed by grasping and pulling on the ankles or forearms. The clothing drag, performed by pulling on a person's shirt in the neck and shoulder area. And the blanket drag, performed by rolling a person onto a blanket and dragging the blanket. In this program, take standard precautions means use appropriate personal protective equipment, or PPE. PPE is equipment worn in the workplace to minimize exposure to hazards that cause serious injuries and illnesses, such as blood or airborne organisms that can cause disease. During infectious disease outbreaks, take extra care to avoid exposure to potentially infectious bodily fluids, droplets, and airborne particles. Use appropriate PPE for the circumstance. Avoid unnecessary direct contact and limit the number of first aid providers near a potentially infectious person. Depending on your role as a first aid provider, appropriate PPE may include gloves, goggles, or face shields, surgical masks, gowns, respirators, and CPR masks. Practicing putting on and taking off PPE, also called donning and doffing, is critical for your safety and to minimize potential delays in emergency treatment. If you're a designated first aid provider in your workplace, training and practice in donning and doffing PPE according to the program established by your employer is required by state and federal occupational safety and health regulations. At bare minimum, you should wear gloves and eye protection while giving first aid. They will help prevent exposure to potentially infectious body fluids, such as blood, saliva, and vomit. Due to the risk of infection, proper removal of contaminated gloves is imperative. Avoiding bare skin, pinch the glove at either palm with the gloved fingers of the opposite hand. Gently pull the glove away from the palm and up towards the fingers, turning the glove inside out without snapping. Gather the glove you just removed with your gloved hand. Carefully slide your bare index finger inside the wristband of the gloved hand. Gently pull outwards and down, inverting the glove and trapping the first glove inside. Place contaminated gloves in a biohazard waste bag or as directed by your employer's bloodborne pathogens or PPE program. Wash your hands immediately after removing gloves. Follow these 5 steps every time. Wet your hands with clean running water, warm or cold. Turn off the tap and apply soap. Lather your hands by rubbing them together with the soap. Scrub your hands for at least 20 seconds. Rinse your hands well under clean running water. Dry your hands using a clean towel or air dry them. If soap and water are not readily available, use an alcohol-based hand sanitizer that contains at least 60% alcohol, and wash with soap and water as soon as you can. If the scene is safe, assess for responsiveness. A responsive person will give an answer or react to you easily or readily. A responsive person can express their consent or refusal to be helped. If the victim appears unconscious, tap them and ask loudly,
Hey,
"Are you okay?"
are you okay?
If they do not move, speak, blink, or otherwise react in a normal way, consider them unresponsive. Consent to help is implied when a person is unresponsive. If the person is unresponsive, or if you recognize the signs and symptoms of a life-threatening condition in a responsive person, or you are just unsure, call 911 to activate EMS using a mobile device, or activate your occupational emergency action plan. EMS dispatchers, also called telecommunicators, have the responsibility to prioritize emergency calls using information provided by the caller. They notify and dispatch the appropriate responders and offer first aid instructions to callers. When you activate EMS, listen to and follow the dispatcher's instructions. Answer questions as clearly and concisely as you can. Turn on the speaker function of your mobile phone so you can listen to the dispatcher and provide first aid following their directions at the same time. An Emergency Action Plan, or EAP, is a written document required by certain Occupational Safety and Health Administration standards. The purpose of an EAP is to facilitate and organize employer and employee actions during workplace emergencies. Emergency action plans take into account the specific layout, size, and features of a particular worksite. As a trained first aid provider, you must know how to activate your EAP at work. It might be just calling 911, or you may have to use an internal phone number, intercom, public address system, or a specialized emergency notification system. If you find yourself in the midst of a medical emergency alone, or with no or limited first aid equipment, call 911 to activate EMS using a mobile device, or activate your EAP. Listen to and follow the dispatcher's instructions. After activating, and unless they are readily available to you, send someone to get the first aid kit and AED. The first aid kit should meet or exceed the minimum requirements for workplace first aid kits and supplies. Both the first aid kit and AED should be able to be obtained quickly and easily from a well-marked, designated location. Assess the person's breathing for no more than 10 seconds. Look at the chest and face for signs of normal breathing. Normal breathing is effortless, quiet, and regular. Take action based on the person's responsiveness and breathing. If the person appears responsive, obtain consent. Introduce yourself and ask, "May I help you?" If the person is unresponsive and breathing normally, maintain an open airway. The airway is a passage by which air reaches a person's lungs. When an unresponsive person is lying flat on their back, decreased muscle tone and the pull of gravity causes the base of the tongue to obstruct the upper airway. Without an open airway, the person cannot breathe. Their heart will stop within minutes. The recovery position uses gravity to keep the tongue from blocking the airway and allows fluids to drain from the mouth. Place an uninjured, breathing, unresponsive person on their side in the recovery position to help protect the airway. Place
Okay. That covers everything we need to know. So I want to make sure it's clear. This right here is the process when you walk up to someone. You're going to make sure that the scene is safe for you. You're the number one person that is in a scenario, you're the number one person in the sense of what? They could be already dead and gone, whether it's someone who, how do you know if they walked across the street, got hit by a car, they had a heart attack, they tripped and fell, but you can't just walk out into that street and think everything's okay. Okay, you have to make sure that you're okay. You have people who are loved ones who want to see you at home, and just like the verse in Quran says, basically you take care of yourself first and then everyone else. This is not about nafsi. I don't care about anyone. It's just that you just have to be in a position to be able to help someone. Does that make sense? Okay. Let me make sure. Okay, we'll get back to this. So when we get into these groups, we're gonna break you down into little groups here eventually. Is that basically you're gonna make sure that the scene is safe. You're gonna check responsiveness. That means you tap them pretty hard on their shoulder. Okay, for the infant. For the adult. For the infant, you're basically tapping them on their feet.
CPR.
Okay? I'll get back to that in a second. You're going to activate, they said EMS or EAP. EAP stood for what? Who remembers?
Emergency.
Yeah, emergency action plan, right? But what's easier to tell someone to do? Say, call 911, right? Call 911 and get an AED. Just so you all know, this machine we installed a defibrillator about, I don't know, 6, 8 months ago. All right, it sits. Does the sisters know where it is? Okay, this is just so you know. Let's try to. Where are we? When you walk into the building, right? The elevator's to the left. The stairs is to the left, right? Right. Stairs to the left. You walk into that area, the foyer, and the brother's prayer is here. Right on the right here is going to be a little cabinet, and it has this defibrillator. I'll go over the defibrillator with you. Okay. I just want to make sure we respect the time because an hour will go by really fast because I talk a lot. Okay. So EMS or EAP, just say, hey, call 911. Go get the AED. Okay, sisters, or everybody, brothers, did you know where it is? Have you seen this thing? Yes. Okay, I just want to make sure if you do not know where it is, please send the sister to remind you. We'll walk downstairs and make sure you visually see it. Okay, if you can get an AED on a person in the first minute, the statistic shows a 90% savior rate. Okay, 90%. And you got to know where that AED is. So if you tell me everyone's freaking out, and look, we know how the Muslims are. When I say that, once we go to a janazah and someone dies, everyone loses their mind. Not to mention when you have a real life, when I say real life, you have something that's happening right in front of you. Okay? All right. So, and then first aid kit, you don't have one, but we'll assess the breathing. We'll talk about that shortly. Any questions at all so far? Okay? I am moving at a steady pace just because I want to make sure we get done before Monday. Okay? All right. Very good. So, one last thing. Oh, no, it's okay. We don't. I can cover that later. All right. Sudden cardiac arrest. We primarily focus on adults because the leading cause of death for adults is cardiac arrest. That's what we're going to see a lot of it. Do infants pass away? Do pediatrics pass? They do. But in the end, the leading cause of death for infants is what?
Choking.
Choking. The leading cause of death for adults is heart attack, cardiac arrest. All right. We, as Muslims, we eat good food. All right. Biryani, we have all kinds of good stuff. In the end, we cook with oils, all those things, and it doesn't matter in the end, you know, biryani or no biryani. We basically have what? Our arteries can get all clogged up, okay, and they block, and that's when we have that heart attack, okay? Since we're not doing first aid, we're only doing CPR, I just want to make sure it's clear. When someone has a heart attack, I use my fist as my heart. At the top of our heart, we have what's called an SA node, which sends an electrical signal, and the heart responds mechanically, okay? That's what happens. When there's a block in your artery, whatever is on the other side of that block, so let's just say this knuckle here is the block, and so everything down here does not get any more blood, and it's not getting any oxygen. That part of the heart starts to die off. The heart says, okay, and it just starts to freak out basically, and it starts to fire from different parts of the heart. Is that clear with everyone? So that nice steady rhythm becomes like this, like what we like to call a bag of worms. Or it's called an ectopic heart, but in the end, it's just going like this. When you put the AED on, and we'll cover that, it sends a shock to reset that heart. Okay? Is that clear with everyone? In the end, we are seeing cardiac arrest, meaning blockages in heart and so on, more than ever. It is no longer what we call an older or elderly disease. It's no more 50s or 60s or 70s. We're seeing it in the 20s and even in the teens. Okay? So what I'm trying to tell you is that please don't look at someone and say they look like they're young. Exactly, you look young. What is wrong? My chest hurts and they're turning gray, or sweating, and they're pale. Could they have anxiety? Could it be anxiety? It could be, right? Who knows what it could be, right? But in the end, we don't want to simply disregard heart attacks / cardiac arrest. Once again, heart attacks is when someone's color changes. There's all kinds of different symptoms. You don't need to know them all, right? But cardiac arrest is when they actually go unconscious. Okay, so let's watch.
Cardiac arrest is the loss of the heart's ability to pump blood through the body due to an inadequate or absent heartbeat. Cardiac arrest is among the leading causes of death in the United States and worldwide.
I love the spaciousness of it. It fits our family.
Awesome, great.
But we just need to talk a little bit about the price.
Okay.
Just give me that stuff and drop the price, at least a couple thousand.
A couple grand.
That's
You can do it one day, yeah.
I really don't know if I can do that. I can't promise anything, but let me go talk to my sales manager.
Okay.
The
Yeah,
most
appreciate
dramatic
that.
occurrence, sudden cardiac arrest, or SCA,
You okay?
can happen with little or no warning.
Here? Are you okay?
Sudden cardiac arrest occurs when the normal electrical impulses in the heart cause it to beat too quickly, inefficiently, or in an unsynchronized manner. When the lower chambers of the heart beat too quickly or quiver, the heart cannot pump blood. These abnormal heart rhythms are known as pulseless ventricular tachycardia and ventricular fibrillation. Blood flow to the body, along with the oxygen it carries, abruptly stops. Within minutes, brain cell death starts to occur from the lack of oxygen.
Are you all right?
Victim of SCA may suddenly collapse.
Honey, are you okay? Somebody please get some help. Are you okay, honey?
Ma'am, I'll be right there.
Please hurry.
Occasionally, SCA victims will experience 10 to 20 seconds of seizure activity when the brain stops receiving oxygen. Normal breathing stops. Abnormal gasping may last for several minutes.
Jack! Jack, wake up. Jack!
Hey, buddy, you okay? Buddy, you alright?
Jack!
Alright, we're gonna have to activate the emergency action plan. Get me an AED and a first aid kit.
CPR is the immediate treatment for suspected SCA.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18.
CPR can restore limited oxygen to the brain and other vital organs through a combination of chest compressions, an open airway, and rescue breaths. However, CPR alone is not enough. The most effective way to end pulseless ventricular tachycardia and ventricular fibrillation is defibrillation using an automated external defibrillator, or AED, with electrode pads adhered to the chest.
Pull red handle to reveal pads. Look at pictures on pads.
An electric shock passed through the chest may restore the heart's normal contractions.
Do not touch patient. Analyzing heart rhythm. Clear. Press flashing button. Shock.
Immediate high-quality CPR and early defibrillation with an AED can more than double the likelihood for survival. These two elements are parts of the adult chain of survival, a series of 6 interdependent links that describe the best approach to cardiac arrest care. Each link in the chain is essential for the most positive outcome. If a single link is missing, the chances for survival are greatly reduced. The chain of survival consists of early recognition of cardiac arrest and prompt activation of EMS, immediate high-quality CPR beginning with chest compressions, early defibrillation with an AED when indicated, effective advanced life support treatment, effective post-cardiac arrest care at a hospital, and recovery. The greatest chance for survival exists when all the links of the chain of survival are strong.
All right, so it doesn't matter if it says adult, it's child, it doesn't matter which one it is. I just want to make sure this is very, very clear. We want to give the person the best possible outcome, right? We want what's best for what? What's the idea? Who wants what's best for myself, my brother, my sisters? You know what I'm saying? Right? We want the best for them, the best for us. So we want to do the best we can for them. I want to make it clear here that basically is that if all of these line up from our intentions and our efforts, we give the patient the best possible outcome. If one of these links are missing, that could be the reason why the person died. I understand, I know that everyone has their time and place, and that's the point. As Muslims, we understand that we can do everything perfectly, but they still die. You can, and that could be maybe the 25-year-old. And you can miss one of these. Let's say you don't know where your AED is, or you don't get a good signal on your phone, or you don't have enough people to do compressions, or there's a delay in the fire department. Everyone probably knows there's a firehouse right up the street, yes? It's a busy firehouse. What happens when that firehouse is dispatched to another location? Where's the next firehouse coming from? How long does it take? And by the way, sometimes when we're sitting in class, we think about that this is someone else I'm about to help. So you all are here to help other people. But obviously this is for you as well, correct? Right? So we want to make sure that all these links line up, do the best we can. We're going to be covering, when I say you all are responsible for the first three, there's a defibrillator here in this masjid. There are people in this masjid, and we all have phones. So let's talk about the phones for a second. When you call 911, you're going to get an automated answer that says, do you need police, fire, or ambulance? You're going to say, I need an ambulance. The next question is the most important question that we ask you. What do you think that is?
Location.
What?
Location.
The location. All right? What is the address of Iswa? How many people, put your hands up. How many people know the address of Iswa? 1, 2, 3, 4, kind of, right? And everyone else just drives here. Is that fair? You know it? 6, 5, what is it? What is it? 27, okay, very good. Did Amu know it? I didn't know anything. How did I get here? Because I know how to get here. Does that make sense? How many people have a relative or a place that they go on a regular basis and we don't know the address? It's a common occurrence. For a while, when the whole cell phone world came out, I knew a ton of numbers. I don't know numbers. How many people know our numbers of our spouses, our children, our parents, or we just tell Siri or Alexa to make the phone call for us? Fair statement? Okay? You might be able to try. I don't know. I've never tried it. Hey Siri, where am I? It's possible that she might know. Okay? If not, the FBI and CIA. Okay? Just make sure it's clear. All right? So, I cannot emphasize this enough. And here's, once again, I'll tell you. If it was you on the phone, because I've taken phone calls like this where I said, do you need police, fire, and ambulance? And it sounds like this. Can you give me some numbers? And we can barely understand them. And you, as a 911 call taker, you feel fairly helpless, okay? One specifically I remember was on the inner loop of Beltway, 495, where the guy can hear the cars going by, and all I'm hearing is, and he's trying to breathe and tell me where he is, okay? So if it was you, you want to consider that when you call, okay? When you call, just make sure you know that you're calling for someone who's down. It's not your emergency, but you should know where you're not should know. We're going to ask you. Now, if you say I am at Iswa, and they go where? You say Islamic Society of Washington area. That's exactly right. There's all these acronyms. How can you keep up with them? If we don't find it, guess what we're going to do? What do you think we're going to do? On Google. Well, just turn to our computer and go, okay. But we prefer that you know the address. Is that clear? And I will tell you that if you can live in your home for 10, 15 years and your loved one's on the ground, first thing you'll do, out the door, what's the address? And I've taken these calls. I've taken the calls. Okay, can you just get here? And where are we calling from? A home phone or a cell phone? Cell phone. How many people have a home phone? 1, 2, 3, maybe? Right. So 3 people, 4, right? Everyone is calling from a cell phone. We do not know where you are. They can triangulate. Sometimes it's 2 feet away, 20 feet away, 20 yards away, 200 feet. And it could be who knows how far. And even if it was exactly in this location, this has 2 floors. What floor are you on? Are you in the corner over there? Are you downstairs in the corner, whatever's downstairs? Or whatever you're on. You have no idea. For every minute that goes by, no CPR being done, there's a 10% survivality rate decreases. So within the 10 minutes, you don't even have a patient. Is that clear with everyone? So when you call 911, just so you know, these are our first 4 initial questions. What is the emergency, your phone number, your name, and I'm sorry, the address, your phone number, your name, and then what's the emergency? Okay? Don't try to interrupt us. Let us ask the questions. If you say we're doing CPR, we will say hold on, don't hang up, and we'll send some help to you, and then we'll continue to ask. Just keep in mind, when you say address, we want to know specific location, in front of, next to, in the parking lot, 2nd floor, 1st floor, in the restroom, in the gym, in the cafeteria, whatever the case may be. Try to give us that detail quickly after that. Otherwise, it's not a big conversation. Let us take charge of the call. Okay? Just so you know, this process to this question takes a minute. by the time we're dispatched is another minute, minute and a half before they even leave from right here. Our normal response time in Montgomery County is 5 to 7 minutes. So from here still, if it's 2 minutes, probably by the time they get here, it's probably 3 to 4 minutes. That's still a long time for you to do compressions. Does that make sense? Okay? Any questions about 911? All right, I want to move quickly because by 6:30 I want to get you onto these mannequins and then something like that. 6:30, 6:30, I think we can do it. Okay. Adult compressions mean compressions pushing on someone's chest. When you push on someone's chest, basically what you're doing is you're circulating blood through the body, 1, and 2 is every time you push on the chest, air goes out. And when you release, what happens? Air goes back in. Okay? That's why one of the reasons you don't have to breathe anymore. If you have a burning desire to put your mouth in some stranger, you can do that. We're not going to teach you that, but if you do, you pinch the nose and you breathe into the mouth. You don't have to do that. Our savior rate in Montgomery County by hyper-focusing on compressions has increased from 5% to almost 40%. So don't feel like, oh, I have to breathe. You don't. Just do the compression. So even though they're going to talk about it in here, don't worry about it. And when I say, and I'll play the video after this, is when I say adult, is a 13-year-old the same size as you considered an adult? The answer is yes. Young man, how old are you? 15. 15. Can you stand up? How old are you? 15. Stand up for me real quick. Stand up. No. Okay, good. You ain't got to get all swollen on me, bro. All right, you can have a seat. You see they're the same size? They might not be as big boy as I am, right? But what I'm saying to you is that you're the same size. I would treat you the same way. 2 hands. As you get smaller, you can just use simply 1 hand. And if you have an infant, you can just use 2 fingers. I'll show you that here in a second. Okay? But at the same time, if you are 250 pounds and the patient is a 90-year-old male or female fragile, that does not mean you're going to be going to town on this person. Okay? Make sense? All right, very good. Let's watch.
As a single CPR provider, first assess scene safety. Before anything else, pause to make sure the scene is safe for you and the victim. If the scene is not safe, do not enter it until hazards have been minimized or eliminated. This includes taking standard precautions. If the scene is safe, assess responsiveness.
Are you okay?
Tap the victim and ask loudly, "Are you okay?"
Hey, are you okay?
If the person is unresponsive,
this is
call
what you're going to do, so
911
pay
to
close
activate
attention.
EMS using a mobile device, or activate your EAP.
Please activate emergency response.
After activating, and unless they are readily available to you, send someone to get the first aid kit and an AED. Look at the person's chest and face for signs of normal breathing. Normal breathing is effortless, quiet, and regular. Look for the chest to rise and fall. Weak, irregular gasping, snorting, snoring, or gurgling sounds are known as agonal breaths. This is not normal breathing. It is a sign of cardiac arrest. If an unresponsive person is not breathing normally or only gasping, immediately start CPR, beginning with chest compressions.
High-quality CPR is the primary influence on survival from cardiac arrest. High-quality chest compressions are the foundation of high-quality CPR. External compression of the chest increases pressure inside the chest and directly compresses the heart, forcing blood to move from the chest to the lungs, heart, brain, and the rest of the body. When chest compressions stop, blood flow decreases significantly. When compressions start again, it takes several compressions to restore blood flow. The more times chest compressions are interrupted, and the longer the interruption, the less the blood flow to the brain, heart, and other organs. Minimal interruption improves blood flow. CPR should be performed where victim is found, as long as it is safe to do so. To deliver adult chest compressions, position the person face up on a firm, flat surface. If the person is face down, carefully roll them over. An injured person should be left in the position in which they were found to avoid potential further injury. Position yourself at the person's side, kneeling close to one side of the chest. Place the heel of one hand on the center of the chest, on the lower half of the breastbone. Place the heel of the other hand on top and parallel to the first. Interlock your fingers if necessary to keep them off the chest. Alternatively, you can place one hand on the center of the chest and use your other hand to grasp your wrist for support. Position your shoulders directly above your hands and straighten your arms to lock your elbows. Push hard and deep, straight down, using your upper body weight to compress the chest at least 2 inches, or 5 centimeters. At the end of each compression, lift all your weight off the person's chest, allowing it to completely recoil or rebound to its normal position, but do not lose contact with the chest. Complete chest recoil allows the heart to refill. Avoid leaning on the chest between compressions. Push fast. Compress the chest at a rate of 100 to 120 compressions per minute. A CPR feedback device transmits information on compression rate, depth, and recoil. Providers can significantly improve chest compression quality by adjusting technique based on data from a feedback device. Using a CPR feedback device is shown to improve outcomes and is recommended during CPR training and in real-life resuscitation attempts.
Okay, so first and foremost, all adult patients have to go onto the ground. Okay, there's no question about it, not in the bed, not in the chair, but on the ground. Okay, that means if you check, as I was doing with the brother here, who's no longer here, basically, I have to get, I don't care if it's 200, 250 pounds to the ground, it's not going to look pretty. Just do the best you can. Once you're on the ground, you're going to go through that process of checking this thing, all that other, well, we're going through the process of chest compressions. Now, they mentioned chest compression ratio, which is 30 compressions to 2 breaths. 30 compressions to 2 breaths. All right, you are no longer required, so your job is to do continuous compressions. It talked about a feedback device, right? It's not up there. Basically, that feedback device looks like this. This is a feedback device that just you simply push, okay, and you follow that rhythm. It is imperative that you try to get a nice steady rate as you push, just like our heart is beating right now, right? You want to do the exact same thing, all right? As far as, and that's the ratio right there. As far as the depth, I'm just going to tell you, if I look at someone and I see that they're a bigger person than I am, I'm not going to compromise on the chest compressions. In other words, it says 2 inches, but that doesn't make much sense to me. Why? If I was to hold my arm out and I say, how long is my arm from here to here? Most likely you're going to have to look this way. So if I say, how long is this? You might say, oh, it's 5 inches. But if I go this way, you can't tell. Does that make sense? So similarly, when you're looking down onto the patient, it's hard to tell how far you're pushing. Today, all the mannequins have a clicking sound and lights. Even though if it has one light, if you push, you see the 2 lights, yes? Okay, you see 2 lights? If I go too fast, it shows an orange blinking light. Okay, and if I go too slow or don't do anything at all, it turns red. Okay, same with the adult mannequins. The adult mannequins actually have 2 lights in the left-hand corner. I'll show you that here shortly. You're obviously not going to have that in a real-life person, but the whole purpose is that you don't compromise on the chest compressions. Don't worry about breaking ribs. You can fix the broken bones later. Is that clear with everyone? Push hard, push fast. Recoil, it showed you. If you push from here to here, you have to come back to the same starting point. You can't push and stay low down here. I'll show you. Flat hard surface, center of the chest. The best place you can find it as best you can. Most of us know where the heart is, yes? Center of the chest, the lower part of the sternum. You have a notch here, right here in the center. Is that clear with everybody? All right? Any questions? So I just want to show you, just to make sure it's clear, and I'll show you it all together as well. This mannequin is what we're going to use today. It is not the largest mannequin. It's not that large of a mannequin, but you're going to end up pushing like this. Straight arms, straight shoulders. You're bending at the waist like a hinge. Before I have you all do this here shortly, I will show you on the ground. We'll all kind of gather in one place, and we're going to show you what we're going to do. Okay? The second thing that's just not just as important, but very important, is the defibrillator. This is your AED right here. Okay? After we show these 2 videos, I'm going to show you the AED. I'm going to show you the training defibrillator, and then you all are going to break into groups. I have 6 mannequins, right? And I know 2, 4, 6. That's perfect. Brothers, sisters, I think my disc brothers 2, and the sisters will have 4. And you're going to work together like 2 or 3 people per mannequin. I'll explain what I want. Any questions, first and foremost, about compressions? Everyone's seen it done on TV, but hopefully today you're going to get that practice, okay? Let's talk about the defibrillator.
An automated external defibrillator, or AED, is a portable, computerized device that is simple to operate. It can identify pulseless ventricular tachycardia and ventricular fibrillation and deliver an electrical shock to restore the heart's normal contractions. If the electrical shock is effective, there will be a return of spontaneous circulation. The heart will be able to pump blood. The person may also start breathing, moving, or reacting in other ways. AED design varies by model and manufacturer, but they all operate in a similar manner. If you have an AED in your workplace, be familiar with its operation. Opening the lid will turn on the power for some AEDs. With others, simply press the power button. This starts voice prompts and readies the device for use.
Remove all clothing from patient's chest.
Proper AED operation requires direct contact between the pads and the person's skin. Any clothing in the way must be removed. This includes swimsuits, bras, and any other clothing covering a person's chest. If necessary, cut through clothing with the shears that are typically included with the CPR and AED response kit. Locate and pull out the defibrillation pads. The pads have pictures on them to show proper placement. Peel the pads from the backing sheet one at a time and place each according to the pictures. Press the pads firmly in place. Pads must not touch or overlap each other. Avoid placing the pads over medication patches or implanted devices. Try to apply the pads within 30 seconds after the AED arrives. If another provider is present, have them continue giving compressions while the pads are being placed. When the AED voice prompts you, clear the person and allow the AED to analyze the heart rhythm.
Analyzing heart rhythm.
Be certain that no one is touching the person. If the AED advises a shock, it will prompt you to clear the person again.
Do not touch patient.
Everybody clear?
For most AEDs, delivering a shock is done by pressing the shock button.
Shock delivered.
Once a shock has been delivered, immediately resume CPR, starting with chest compressions. After about 2 minutes of CPR, the AED will prompt you again to analyze the heart rhythm.
Analyzing heart rhythm.
Follow the voice prompts.
Everyone clear.
Everybody clear?
Shock delivered.
Continue CPR and AED use until another CPR provider, someone with more advanced training, or EMS providers arrive and take over, or until the person starts breathing, moving, or reacting in other ways.
Okay, that last image that you saw where the lady comes up, taps and he moves, ideally you should not do that. If you have the space, the patient is always between you and the other person. She and I are here, I'm doing the compressions, he's doing the defibrillator. Does that make sense? Or if he's doing the compressions, I have the defibrillator, one or the other. Does that make sense, everybody? Thank you. All right, I just want to make sure that's clear, because this whole idea of coming around like this is a waste of time and waste of space. You have your job to do, I got my job to do. Is that clear with everyone? Any questions about the defibrillator yet? I still have one more video, and then I'm gonna have you all come up here. I'm gonna show you. We'll bring the camera in as well. All right, let's watch one more. This is precautionary measures when using a defibrillator, okay?
A CPR provider may face some circumstances that require additional considerations or tasks for effective care. Act quickly if anything affects AED use to keep this link in the chain strong. Thick chest hair may prevent the AED pads from adhering to the skin. If chest hair is preventing pad to skin contact, use the razor that is typically included with the CPR and AED response kit to quickly shave the spots where the pads will be placed. If you do not have a razor, but a second pair of pads is available, use the first set of pads to remove the hair from the skin. Apply the first set of pads firmly over the chest hair, then pull the pads off quickly. Then apply the second set of pads. Do not use an AED if the person is immersed in water. The person must be removed from water before using an AED. If the person is in a wet setting, such as lying in snow or ice, in rain, or on a wet floor or deck, or in a small puddle, it is safe to use the AED. If the person's chest is wet, quickly dry the chest before applying pads. AEDs can be used safely on metal surfaces, such as gratings or stairwells. Make sure the pads do not directly touch any metal surface when the AED is powered on. Persons at high risk for cardiac arrest may have a surgically implanted defibrillator or pacemaker. Most often, a noticeable lump is visible in the left upper chest, though sometimes the implant is in the upper right chest or abdomen. Avoid placing the AED pad directly over the implant, as the device may interfere with shock delivery. Do not place AED electrode pads directly on top of a medication patch. A patch could block delivery of the shock from the electrode pad to the heart and cause small burns to the skin. If it doesn't delay shock delivery, peel off the patch with a gloved hand and quickly wipe the area before attaching the electrode pad. If the AED pads are not in contact with metal jewelry, the jewelry does not have to be removed. Do not delay chest compressions or defibrillation for a pregnant woman. Follow the normal steps for operating the AED. The shock from the AED will not harm the baby. If the woman starts breathing, moving, or reacting in other ways, place her on her left side to improve blood flow. Resuscitation puts CPR providers at an increased risk of occupational exposure and infection from bloodborne and airborne pathogens. CPR providers should routinely take standard precautions during resuscitation, including using a CPR mask with a HEPA filter when available.
Okay, any questions at all? Nothing?
Yeah, I have a
Okay,
question.
yes.
I mean, I know this is a serious matter and it's life-threatening. So can you address,
Yeah.
Can you address the fact, like they
Women?
say, the women
Sure,
take
no
off the clothes and
So,
stuff like that and.
Very good, no problem. I know where I'm sitting, I'm in the masjid, I understand. I'm just gonna let you, like I said earlier, if the women here, if it's someone who, it's a woman that, a sister that collapses, then let the women handle it. In my career, it's a little different when I say that just because of the nature of what I do. You'll ask doctors and nurses and anyone who's in the medical field. And legally, let me phrase that, not legally, Islamically, you can treat them. Ideally, we want a woman to treat a woman and so on, and a male to treat male, right? It's a fair statement? Okay? But in the end, right, when we put a defibrillator on, ideally we need to have a completely bare chest. Can we put like the pads here, like on the bra here and here? Yes, but we do have to expose the patient to get to it. There is a masjid fairly close to here that we work with them. They were smart enough to use the defibrillator, okay, on a brother who passed out. Alhamdulillah, he just passed out, he came to, but they still put the defibrillator on. The only problem was instead of cutting off the clothing, they tried to take the pads, right, and these are just training pads, that what I'm about to show you, but they took the training pads, they peeled them, and then they tried to lift the shirt and go under. And what happened was, this specific AED that they used was not two separate pads like this. It was it's a specific AED that has pads that are all connected, all one piece, that looks like this, this, and this. So they tried to shimmy it up under the shirt. What do you think happened?
It didn't work.
They got stuck, folded, this, that, it was no good. Okay, does that make sense? Right? Is it easier to do something like this? It probably is, right? But in the end, look, the idea is we're not trying to just like cut shirts off and we're not trying to expose people, but it's just part of the nature of trying to help somebody. Okay? And it's just like if you were someone in, I don't know, as a mechanic and you were saying, this is what you need to do, we have to move these pieces to get to that part, you're not gonna say, no, just fix it without without taking all those parts. We can't, right? It's the same thing. Okay, is that clear with everyone? Now, just before I go any further, this is your AED downstairs. It's got that kit on the side that they're talking about. In this kit, it's got a face mask, it's got scissors, it's got the razors. Just so you know, the thing when they rip the hair off the guy with the pads, it doesn't happen on a regular basis. Usually it's more lighter hair, it's kind of more this, it's not, if it's like really thick hair, it's not gonna rip off like that. In these things here, okay, you have a cheap 99-cent razor. You simply as much as you need to, and then you put the pads on. If you notice, it does have a mask in here. You can breathe into the mouth of the patient. Great if you want to. It's got gloves, it's got wipes. If someone's really, really sweaty, you can wipe them down. In the end, these are your trauma scissors. This will cut through heavy jackets, sweatshirts, you name it, it will cut right through it. Your favorite hijab, sorry sisters. All right, I know y'all spend, because I got $3 this one. That's why I got no money. Is that couple some money? So in the end, this is what it's for. Okay, is that clear? I know all my hijabs too. Don't try to, I know how to, never mind. All right, so this AED right here does not have to be unzipped. You can function right here. there is a on-off button. I know everyone can't see it, so I will take it out, but you don't have to because there's a little hole for the speaker, and this is where you pull the pads out. But just to make sure you can see it, this is what it looks like, okay? There's a green button here for the on-off, okay? And then there's a button here.
Adult patient, call for medical assistance.
So if you don't know what to do, you have this, is like call.
Remove clothing from patient's chest.
Remove the clothing. Cut, 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 cut. Okay? Then it says,
Pull green tab.
I'm not going to pull it, right? But what happens when you do pull it out, pads will come out like this. Okay? It'll look just like this. Let me just put this
Peel pads from liner.
So it's this peel pads from liner. This one, they're all a little different, but I know I'm going to start over here for the sisters. This one goes here, this one goes here, somewhere in this area, it doesn't matter, as long as there is a heart somewhere between these two pads. Okay, so it's here and it's here. What happens if someone has an internal pacemaker or something like this? Could you put it back here and here? The answer is yes. And what happens if you mess up and you do it this way? It works. This way it works. Pregnant people this way, just don't put it on the same side. Okay, then it won't work. You can put it here and here, and it'll still work. Does that make sense for everybody? Any questions so far? All right, I want everyone to come up here. If you want to get out of this.
Get the lights on.
Oh, yeah, if you want to turn that light on, sister, right there, please. Okay. How are we, YouTube?
Hamza.
Stands for automated external defibrillator. That means they need internal ones. Make sure everyone can see. If you need, put that out of the way. Sisters, come around the corner. Okay? So this is what's going to happen. I didn't count specifically. 1, 2, 3, 3. Okay. So we have more sisters. So we're all going to try. To brothers, we're just going to split you right in half. Okay? And that's okay too. You're going to figure out who's going to do what. And sisters, can everyone see? Just want to make sure everyone can see. Okay. So you have a mannequin here. If you notice here, I told you when you do your compressions, you should see 2 lights. Everyone see that over there? Okay, 2 lights. If you push too fast, it's going to be a flashing light. And if you don't push at all, it's going to turn red. Okay? So you are going to work and you're going to hold each other accountable. Okay? In other words, if you're not doing compressions, like for example, can I get this? I can, but look, nothing's happening. Okay? You want to make sure you feel a clunk at the bottom, and you're gonna come to the same starting point. Straight arms, locked in, just like that. Now this does not have a back. You understand what I'm telling you? In other words, in real life, that patient could be up here. It could be a very barrel-chested person. You might even have to do this and that. Okay, does that make sense? But you want to encourage each other. So we're gonna decide which name.
Hamza.
Hamza, Amer. Nice to meet you, bro. I like that emotional.
Question.
Yes, sir.
You don't have to bounce your hand, isn't it? You have to stay on that.
Yeah, you don't bounce. I didn't bounce. In other words, when I say you don't bounce, you don't come off the patient because you can move. Okay, does that make sense? All right. So the way you're hooked up like this, so you're going to be facing each other here and here. Okay, but his job is primarily the compression job. Is that clear with everybody? Now, I'm going to just, for the sake for him, I'm going to turn this around so he can see the 2 lights. Now, what's going to happen is you're going to decide who's doing what. So right now, Hamza's going to do compressions. I'll be the AED person. You could be 911, and you could just be the next compression person, so to say, if that was the way we're going to do it. So as you remember, the first thing you do is check for safety. The scene is safe. Hamza, go ahead and tap real hard. Okay, very good.
Are you okay?
I'm okay. Are you okay?
No, not me.
Just tell this sister here to call 911.
That's his mom.
Okay.
Yeah.
Say, Mom, please.
Call 911.
Why are you trying to tell your mother what to do, man? Okay, so call 911 and I'd say go get the AED. It's downstairs. Just hold on.
Please go get the AED.
He said, please to me, myself. Very good. So I'm going to go, while I'm gone, he's going to check for breathing. So the breathing, just so you know, is from the second rib from the bottom all the way to the clavicle. So you might have to, like, let's just say he's got a thobe on, it's winter and jacket. We're going to move everything and we're going to put our hand right here and we're going to put it between the rib. So put your hand there, and for 5 or 10 seconds, we're just looking for breathing. He's not breathing. So he's gonna start doing the compressions. Is that clear? Where's my, you got my keys over there, somewhere behind you? Are they on my desk? I don't know, that little beeping sound. Is that it? You can throw it to me, don't lose that. All right, so put your hands here, the heel of the hand in the center, the other one on top. Now, what he does here, like this, it does not matter, okay? And then he's gonna start pushing to this rhythm. Okay, you can see two lights. I know the sisters can't see. Come around the corner if you need to. As I come from the side, you can. Actually, Hamza, let's move this way.
Alhamdulillah.
Okay, now everyone just watch. I'm going to show you this. It's very simple. As he's doing that, I'm going to hit the green button. You got to push kind of hard. I'm going to put it on my side.
Apply pads.
It says apply the pads. I'm looking at the picture. I'm going to put this here. It doesn't matter exactly, just in the general area. And then I'm going to plug it in.
Analyzing heart rhythm.
It says analyzing heart rhythm, and then it says do not touch the patient. You want to make sure that the patient is clear. We can be this close, it's not a problem. Okay? Whatever the AED says, you repeat. Okay? Charging, stay clear. You have to listen to this defibrillator. It's like when my wife tells me something to do, I listen. All right. No. So.
Lie. Is that a lie detector thing, sir?
So this thing right here will light up. If you don't push it, nothing will happen. Okay? So everyone stay clear, stay clear. Boom. The hands will pop up, the feet might pop up, and it says begin CPR, and he's going to continue. Now this has a beeping sound. This was like a beeping sound before the AED got there, and you just keep a nice steady pace. If Hamza gets tired, but he won't because his name's Hamza, and he's going to keep on going. I'm stupid. If he gets tired, he can just say, I need a little help, and whenever he's ready, just say, go. I will jump in, and I will do the compressions. In the meantime, he can move. We bring someone else in. Does it see what happens? But my primary job is the compression, is the AED, and their primary job is the AED. It's okay. Is that clear with everybody? The idea is that you never stop. In the end, these AEDs will analyze every 2 minutes. So that means you're supposed to do 2 minutes worth of compressions. If you can't, I can help, you can help, you can help, you can help. It doesn't really matter. When this thing says after 2 minutes, it's clear. Everyone stay clear. Maybe it shocks, maybe it doesn't. Once the pads are on, they never come off. Okay? Is that clear? Yes. Any questions whatsoever what I just showed you? Yes? Yes, some do and some don't. They're all a little different. And you won't believe me when I say this, but it was absolutely hilarious to me. I can't remember which AD it is, but it literally said the beeping sound, it went like this. Push, 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 push. And I thought it was a joke actually, and it kept on doing that for 2 minutes straight. So but some will just say 90 seconds, 60 seconds, 30 seconds, and so on, okay? Either way, your rhythm, you're pushing on the chest, you doing something is better than doing nothing at all. Is that clear with everyone? Yes, sister?
Okay, you leave the pads on until the paramedics arrive?
100%. You leave the pads on, they never come off.
Even if they wake up?
You may, by the way, you may put the pads on, and it may not even work. Why when I say it doesn't work? Meaning the heart is not in that specific, these eight, not these, but the real ones, are looking for a rhythm called ventricular fibrillation. If it doesn't find it, it won't work. Okay, and that's why we say if you get a defibrillator on a person in the first minute, there's a 90% savior rate because it's still like this. But eventually what happens? It stops. What we see in the movies is that they wait for that flat line and then they jump start it. They shock the patient. You cannot jump start a dead heart, just to make sure that's clear. Okay? And you'll never know. Your job only is just to get it on there, and whatever it says, honestly, you just follow.
It will tell you if it is asystole.
It won't tell you if it's asystole. All it tells you is shock or no shock. So what he's saying, asystole is flatline. So it can say no shock advised. And what it's basically saying is that it's not in ventricular fibrillation. But it could be an asystole, it could be an A flutter, it could be in a normal sinus rhythm. All you know is that, hey, the machine's telling me not to do anything. Let me see what the patient looks like. Oh, the patient's still not breathing. If the patient's not breathing, what are you supposed to do? Keep on doing compressions. Is that clear? And if the patient's breathing, what's the position you put him in? Side. So you can raise the arm, raise the opposite leg, and just turn the hip like this. This movement here, opposite arms, so basically it doesn't matter if it's this way or that way. Right? If you do this, oops, hold on. this way, then you just roll like that, and if they're 350 pounds, that hip will follow, and the whole body will just turn, and then you put them on your side like that.
And on the left side.
It doesn't matter.
So-
Don't overthink it. It did say that. I get it, but I'm trying to take these little things out of the way, because in the end, 6 months from now, are you gonna remember? He said left hand. I'm trying to figure left side. The grave, right side, right? But this side, you just do the best you can, okay? Is that clear? So here's what I'm gonna do. We have, I think, 8 brothers, 4 to 7 brothers. You guys are gonna just do 4 to 1 and 4 to 1. Sisters, you gotta have 4 mannequins. Just divide yourself up. No more, it shouldn't be no more than 4 people, maybe even 3 people. And I want you to go through this process more than once if you can. If we can make it to 7 o'clock and be done with this part, I think I could do choking and the infant and stuff before we hit Maghrib, okay? Is that, because I told you I listened to my wife, she said I gotta be home by Isha. Right? Oh no, she's watching, I'm not. Okay, so find someone that you, and by the way, you should find someone that you kind of hang out with. So if you guys come to Fajr, right, or you guys come to Isha, whatever the case may be, I would say kind of work together with them. Why? Just because it's possible that you could, or you could split up. Or you could find someone that looks smart and wears glasses. Whatever you want to do. That'd be you, Michelle. Okay, so you brothers, I want you all to take this, that, and you can be here and here. There's an AD right behind you. Sisters, there's 2 in the back. What I want you to do is I want to have some sisters here. Someone can take this to the back.
Hey, are you okay?
Oh, you got to get a team. Get a team.
The other ones can go
Get
in
2
the back.
people.
4 here.
So,
One,
yeah,
not
the
too-
3 of
don't
you,
go to back,
the 4 of
Just
you.
make sure there's enough room. There's 2 more mannequins to your back. Okay, come over here. Okay.
Are you okay? Are you okay?
Okay, go ahead through the process. I'll be walking you around, talking to each other, encourage each other.
It's the same. Call 911. Go get the same. Call 911.
Don't put this one, has to be. This one? Yeah, that's the way you have muscle. Yeah, yes. That's the one you have muscle.
You are bouncing.
Sisters, do me a favor, there's one over here. Sisters, split up over here, maybe 3 and 4.
After it says breathing, you send me to go get the AD. You call him. Send him to get the AD.
Okay, decide who's gonna do what. Make sure those compressions are on point. 2 lights on the chest. Okay? Yalla, come on. Come on, sisters. 2 lights, sisters, 2 lights. Do me a favor, turn the head. Turn the head.
You got to keep pressing harder, pressing faster. There you go. Keep those green lights. Keep those green. There you go. Keep those. There you go. Keep pressing.
Just so you can see the lights.
Right now, you're trying to use your hands.
Very good. Go ahead, you sisters.
Press the orange button.
Go on the side for the AD.
No. Now we go back.
Follow the prompts.
Keep going. Keep
Follow
going.
the prompts. No, that's the real one. That's right. Use the. Am I missing one? All right.
Oh, this one here. Yeah. Don't
That's the
miss.
real one. Why won't I use the real one?
No, man.
If you're touching the
That's
right
expensive.
one,
There's one over there in the corner.
Huh?
Is there one in the corner over there? Yeah, that one.
Excuse me, brother. All right.
Set him up. Set him up. Set him up.
Keep compressing. He's
Now,
gonna
I
die.
want you to go.
I'm telling
Do me a favor. I want you to go all the way until it stops beeping, until it tells you
Yeah,
to
easy,
don't touch
easy.
the patient.
Keep
Same
pressing.
with you guys.
There you go. Very good.
Until it stops, until it tells you to stop after you put the AED on.
Okay. So we're gonna get
Good. Get your hands up a little bit more.
How y'all doing over here? Keep going. By the way, you never walk in with a patient. No, it's okay, it's okay. Keep going, push harder, till you see the light. Harder. Wait, what's it saying? Sister, sorry, one second.
You can look. You don't have to
Real quick, make
participate.
sure the heel is in the center. Look at me, your heel is here. Now bring it to the center. There you go. If you get tired, tell the sister. Can you try the same? What? Yes, all right. You're so ready.
CPR. Oh, you don't turn the body. You have to turn.
It's not common. They did a study of 400 cases. Only 4 or 5.
Good job. Good job. Good job.
So, except you got Hums on there because you got me wrong.
Go ahead.
You already got some microphone, bro.
Good job, man. Sorry.
The thing is hockey. Yeah, it said analyze.
Slow down there. Slow down. A little too excited. Move your hands. Get off. She's a little too excited there. Okay, you can go back again.
Told you I hurt my wrist.
Slow down. So.
No, like days ago.
So now someone else do the AEDs. Share the, do it again.
Keep going. You got to press harder. There you go. To slow down a little bit. Keep pressing. A little hard. There you go. There you keep that pace. Yeah, it's not easy. Some hard work. Martial artists.
Try it again several times, inshallah. Try it again, sisters. Sisters. Have someone else put the AED on. It's like, yo, you okay? You okay?
Are you okay?
Make sure you repeat. For both of you. Good. I just want to make sure everyone has the opportunity to do quick questions and just make sure you know how to use the AED. How we doing? We're almost done, that's fine. Just make sure everyone has an opportunity to press. Sister, what's your name? Yes. That's how you There you go, that's it. Once you feel like you've got it, you can have a seat.
I can't see the light.
You want to take all the questions? You there? You ready? You're going to take that rhythm. Go, go. No compression. Red. Yellow and square. Yellow and red. No. How y'all doing? Doing good? Sister, you doing great. Do me a favor. Look at me. You like this? You want to stroke? Right? No. And then your heel is over here. You want to be here. Right in the middle.
I'm getting tired, so they're prepared.
All right, folks, let's have a seat. Y'all, if you're done, let's have a seat. Sisters, if you could bring the mannequin up here with the AED, that would be great. Afterwards, do you have my number? Because I'll give them sisters, if you don't mind just bringing those two mannequins up here, if you don't mind. So we're doing really good show.
Thank you.
I wanted to make sure it's clear. How do you all feel it went? I was able to walk around and see most folks, actually everybody. But what I really liked, was the fact that there was communication. And that is key. You have to talk to each other. We were in a safe environment, everything was good. You know, we all had, there's no, obviously not a real person, but in the end, my question, I know the answer. Was it a little bit of work to push on that chest? Yes? Right. Now, add the emotional aspect of it. And I'm not trying to scare anybody, but could it be your parents? Could it be your favorite imam? Could it be your child? Could it be your friend of yours? That all changes and how long you could do those compressions. How many minutes did I say does it take for the fire department to get there?
5.
Well, 5 to 7 minutes. Okay, is that clear? All right, any questions about what we covered? If you find that the person's smaller, just use one hand, and that's totally fine. Okay? Any questions at all? All right, we're going to talk about adult, yes.
That rebound that happens, does that actually happen?
Yes, it does. Actually, as a matter of fact, what you're going to find is there's like flip-flop of the belly, the atmospheric pressure is more than what's inside, so there's gonna be this kind of, where the air will go back in, but it's natural for that chest to go up and down. Yep. And it's it's nothing like that. It's weird. It's the only word I can use. It's nothing like when you do it. And I heard someone say something about breaking ribs. Breaking ribs is not a common occurrence, okay? You might find that on someone elderly more than you find it on someone who's younger. When we're younger, we have that flexibility, even younger, like 2-year-olds, 3-year-olds. But the older we get, the more calcification, the more brittle we get, and that's when you're gonna see those breaking of the ribs. Any other questions?
But I was just saying, you said this is like one only use one hand. So this the same position you use?
Yeah, so what I would say, and you can do this here as well,
Yeah.
I would put my other arm either here or here, because the shoulders still wanna go up and down to create this equal kind of rhythm. You don't wanna do this, because then you start to push across, so to say, okay? So it's here and here and here. Here is fine, totally fine. And then you're talking like the 7, 8-year-old, something like that. And once again, it just depends on your size. If you're a smaller person and this 8, 9, 10-year-old is like, man, this is a lot of work, and you have to do this, then do it. And that's fine too. But once again, they're the 90-year-old and you're a 200-pound person, there's no need to and go to town. And I say that because I've seen it done by firefighters, and we show up as paramedics and we're like, dude, just relax. I mean, you don't have to, oh, I know you're just going to town like this is going to say. It doesn't work that way, okay? That's when you do break those ribs. All right? So, the leading cause of adults we said was cardiac arrest. The leading cause of death for infants is choking. But do adults choke? The answer is yes. We do. And has anyone ever choked for 1 second? Even if it's on a, yeah, it happens, especially during Ramadan. About that in person, right? The sister, the young lady, my sister, with the woman who said she had choked on a grape. My first question was it a Costco grape? Anyway, so let's watch this real quick as far as relief of choking for the adult. Okay, so let's watch. Okay.
Choking, also known as foreign body airway obstruction, can occur when a solid object, such as a piece of food or a small object, becomes stuck in the upper airway. The person cannot breathe. A forceful thrust between the ribs and up into the diaphragm can pressurize the air in the chest and pop out the obstruction. Chest compressions can also create enough pressure to expel a foreign body airway obstruction. To provide the appropriate care, you must be able to recognize the difference between a mild and severe airway obstruction. With a mild obstruction, the person can speak and cough. They may wheeze between coughs. A mild obstruction is typically cleared naturally by the person through forceful coughing. If the person can inhale and exhale, encourage the person to continue coughing. Watch for signs of the airway obstruction becoming severe. When a severe airway obstruction occurs, the person cannot get air in or out of the lungs.
Johnny, what's wrong? Are you choking?
This is a life-threatening medical emergency. If the foreign body is not removed, the person will quickly become unresponsive and suffer a secondary cardiac arrest within minutes. Signs of a severe airway obstruction include the inability to speak, a weak cough, or no cough at all. The person may make a high-pitched noise when trying to inhale or make no sound at all. They may hold their hands to the throat. Ask, are you choking?
Are you okay? Are you choking? Can I help?
If the person nods yes or is unable to speak or cough, act quickly. If you are not alone, have someone call 911 to activate EMS using a mobile device or activate your EAP. Stand behind the person. Reach around and locate the navel. Make a fist with the other hand and place it thumb side against the abdomen, just above the navel and below the ribs. Grasp your fist with the other hand. Quickly thrust inward and upward into the abdomen. Repeat. Each thrust needs to be given with the intent of dislodging and expelling the object. Continue until the person can breathe normally or becomes unresponsive. If the object is expelled and there is a good air exchange, encourage the person to be seen by a healthcare professional. Infrequent but serious complications from abdominal thrusts can occur. If the person is pregnant or very large, and you cannot wrap your arms around them, use chest thrusts instead of abdominal thrusts. Position yourself directly behind the person. Reach under the armpits, and place the thumb side of your fist onto the center of the chest. Grasp your fist with your other hand and thrust straight backward. Try to not put pressure on the ribs. Give each chest thrust forcefully with the intent of dislodging and expelling the object. Repeat chest thrusts until the object is expelled and the person can breathe or becomes unresponsive. If the person becomes unresponsive, call 911 to activate EMS using a mobile device, or activate your EAP if you haven't done so already. After activating, and unless they are readily available to you, send someone to get the first aid kit and AED. Assess breathing for no more than 10 seconds. If the unresponsive person is not breathing normally or only gasping, remove any bulky clothing from the person's chest.
Okay, you're gonna do CPR, okay? I wanna make sure that's clear. So you notice when that person that she was holding, that maybe was the same size, this might be a smaller person, and she was able to bring him down to the ground. Well, ideally what we'd like to tell you is that you wanna stand with one foot in front of the other, right? And then you wanna do this, so if they do collapse, you can catch them like that. All right, so I'm gonna show a couple things. Okay, all right, so like this and like this, and if it collapses, what normal people, when they're up here, like drop at your knees. Boom, you see that? Now still, it's gonna be work, don't leave it, okay? I'm just saying that's what's gonna happen, okay? Now, we're the same size, but I'm just gonna use them here, have a seat for a second. Now, what we find also is people, they said if they're choking and you can't get your arm here, where do you go if you can't get around the waist? Chest. What happens if you still can't get around the chest? Okay, we have all different shapes and sizes on what created us in this manner, right? And so how do we deal with that? And specifically whether it's sitting or standing, just sit up for me a little bit. So I can get around Azad, I know I can. I'm gonna go here and here. If I couldn't go this way, just so you know what I like to call the seatbelt technique, I would use one hand over and one hand under. This is a shorter distance than this. Does that make sense for everybody? And he can feel this. I know what you guys have to say. All right. Now, by the way, can I do this while he's standing? The answer is yes. One last thing really quick. If the person is so big that they're so tall, you can get them to lean over the chair and then you hit them in the back. We do not hit in the back while they're standing up. The object goes down further. Is everyone with me? Okay? Thank you. All right, any questions so far for this? Can you do this? Can you do this to yourself? The answer is yes. Can you use the chair and drop onto the chair? The answer is yes. Do whatever it takes to create a force of air to pull that object out. If this had arms, you can grab the chair and you literally just throw it right into your gut. Okay, I've seen it done in real life on a video. Okay, is that clear with everybody? Now, and if you're working with kids, and the sister out here who back there, sister was just saying that I'll go to would you said this week, this past week or last week? Last week. Last week. Someone was choking, object came out. Okay, we're trying. And it's, by the way, if you notice, we can't practice. We're going to practice relief choking with the infant, but you can't practice when someone. I think she had asked me, can you practice compressions? You cannot. You cannot practice this either. I don't care. Don't go home to your loved one tonight and hey, check it out. And then just I don't know if there's a brother and sister you don't like that you pray next to. Maybe the brother comes like, smell like brownie. Just do it. All right. All right, is that clear? But infants do. So we're going to watch this video, part of the video. I'm going to cut it off. I'm going to go right to the infants, and then we're going to do. I'm going to show you what I want here for the infants, and then we're going to be done. You can ask me any questions after that. Okay?
If an infant appears to be choking but is responsive, watch for signs of the obstruction becoming severe. If there is a good air exchange with a mild airway obstruction, the infant is coughing forcefully, has a strong cry, and can inhale and exhale, stand ready to help if things get worse. With a severe airway obstruction, the infant may cough weakly, be unable to cry, or unable to make any sound at all. There may be a high-pitched noise when the infant tries to inhale. If the infant is responsive and you are not alone, have someone call 911 to activate EMS using a mobile device or activate your EAP. Kneel or sit with the infant in your lap. Hold the infant face down over your forearm with legs straddled and with the head lower than the chest.
They don't show you, but you're gonna
Support the head
cup
by
the jaw,
holding the jaw.
okay? Okay, they do, all right.
Rest your forearm on your lap or thigh to support the infant. Using the heel of the other hand, give up to
If you
5
want, you have a
backslaps
mannequin in front of you, you
between
can try
the
it.
shoulder blades. Give each backslap forcefully with the intent of dislodging and expelling the object. Sandwich the infant between your forearms and turn the infant over, using the palm of one hand to support the face and the palm of the other hand to support the back of the head. Place 2 fingertips on the breastbone just below the nipple line and give up to 5 chest thrusts. Give each chest thrust forcefully with the intent of dislodging and expelling the object. Repeat the sequence of backslaps and chest thrusts until the object is expelled and the infant can breathe or becomes unresponsive. If the person becomes unresponsive, place the infant on a firm, flat surface. Begin CPR, starting with compressions.
All right, I'm gonna show you what we want for the compressions. I wanna make sure it's very clear here. If you noticed, they showed you in that video that basically they're on the ground, that she's kneeling down, almost like when we're sitting, right, in the sitting position in prayer, right? So basically you can cup that jaw. Whatever arm you use, you put that same arm on the same leg. Okay, is that clear? In other words, you wanna support. Those who've had kids or picked up kids, they're not as light as this mannequin by any means. Okay, so you're gonna be here and here. 1, 2, 3, 4, 5. Okay? If the object doesn't come out, sandwich and rotate to the other side, 5 of these. Is everyone with me? You want to support that leg no matter what. Has anyone ever done this in real life? All right? Just so you know, the people who have, I've heard where they've turned them over, object comes out. 1, 2, whatever. In the end, you don't have to do 5. If you do 1, 2, and the object comes out, my suggestion is stop hitting the child. It's just me, right? It's a good idea. Unless you didn't like that child, right? So,
if it's your child.
yeah, just your child, man, trust me. If it's someone else's child, halas, man, do it extra. I say that actually jokingly, but seriously, a woman one time, she said she did 15 times. She said 15, she was realized later that she had the jaw shut and covered the face like this, okay? Is that clear? So what I want to see right now, real quick, shouldn't take long. I only have 6, 7 mannequins or something like this. All right, the brothers, right? The brothers can use this one and that one. The sisters, what you're going to do is you're going to be in your chair. You're going to be sitting on the edge of your chair. You're going to make sure your feet are flat. And you can drop your leg, or you can extend your leg, and you're going to try this now. Okay, is that clear with everybody? I will walk around. Make sure you cup the jaw. Gently, 5. When I say gentle, I'm not saying too hard. I can always tell parents, they always like, these mannequins. Yeah, there you go. Just grab it, try it. Very good. I'm telling you all, just so you know, we have a lot of these incidents. Cup the jaw. You have to cup the jaw. 5 and 5. 5 and 5. That's fine. As long as it's somewhere down.
All the object will come out.
And by the way, those arthroplan, they're called chest thrusts, and the objective is different than the compressions. All we're doing now is to try to change it. Go back to where you had it. So when you grab the back of the head, put it on the back of the head. So your hand all the way in the back. So just to that side. Use your left hand on the chest. The left 2 fingers. Use 2 fingers right as the left hand down. Harder. 4, 5. Cup the jaw. No, not the neck, the jaw. See what you got. Yeah, and then roll. 5.
So
When you do the compression, they have to be
Down. Yeah, so similar, they're not, it is compressions, but we use a different terminology, it's chest thrust, and that's to push the object out. We're just changing the anatomical structure
So
of
it
the.
still be down.
Yeah, down.
That's too soft.
Yeah.
I'm scared of the baby.
Wake up. Go ahead. Show your shoulder. Yeah, that's all that matters. Like a little face has to be down. There you go. There you go. Go ahead.
Any questions? Questions? Everyone good? All right, I need a few more minutes of your time to watch one more video, which is the chest compressions, okay? It's fairly straightforward, but I want you to watch the video, and then I'm gonna turn the lights on, and then basically what you're gonna do is you're gonna do this, and then we're gonna be done, and I'll ask for any questions, but I think we got like 15 minutes almost, okay? Oh, wait, one second. Okay, just so you all know, there is a device for those who don't know. This device right here is called the Life Vac, okay? Literally, it's a plunger for your face, okay? They make a pediatric mask like this. It's the same mask you can breathe. But what it does basically, it's got it's got a valve that when you push, air goes out. And when you lift, if you notice, you can lift like that. So you literally, and there's people who have done it to themselves, for infants, whatever the case may be, for the guys, because it's usually guys who want to try to, that's what happens usually. And then literally people say, like, pull your tongue forward, everything else. So don't try this, okay? You can look at it, you can practice here, but probably you two more than anybody else, and the two other, you two, maybe not you two wise much of it. Right? Don't try this at home. All right, but this is once my wife saw this, she's like, you gotta get me one of those.
Yeah.
It's a life-saving device. Okay, and I would say that this is more for instead of like the carrot or the hot dog and so on. Basically, this is when the kids just start slamming like crackers and bread and becomes like mush. Right? This is where this comes really into play. Okay. All right, let's watch this.
There are three main elements of the infant CPR and AED procedure: assessment of the scene in infant, actions based on the presence or absence of normal breathing, and use of an AED. First, assess scene safety. This includes taking standard precautions. If the scene is safe, assess responsiveness.
So,
Gently tap the victim and ask loudly, "Are you okay?"
at the foot, the feet,
Are you okay?
Not the shoulder or the
If the infant
chest
is
area.
unresponsive, call 911 to activate EMS using a mobile device or activate your EAP. Take no longer than 10 seconds to assess breathing. Then take action based on the presence or absence of normal breathing. If the unresponsive infant is breathing normally, maintain an open airway. To help protect the airway, place the infant in the recovery position.
That's the same as when you put your
Cradle the
arm
infant
up
in your
and your
arms.
left leg
Their
up.
head tilted
Just turn them.
downwards to prevent them from choking or inhaling vomit or
You
fluids.
could technically just hold the infant.
Regularly assess scene safety, responsiveness, and breathing. Stay with the infant until someone with more advanced training or EMS providers arrive and take over. If the unresponsive infant is not breathing normally or only gasping, and you are alone, immediately start CPR, beginning with chest compressions. Immediate CPR with an emphasis on effective rescue breaths may provide the only chance for survival. If you are alone without a mobile device, give 2 minutes of CPR. Then bring the infant with you to get an AED and activate EMS or your EAP if you haven't done so already.
High-quality chest compressions are the foundation of high-quality infant CPR. To deliver infant chest compressions, position the infant face up on a firm, flat surface.
So they're going to show you 3 different ways.
If the infant is face down, carefully roll them over. For infant compressions, use one of 3 hand position techniques: the 2-finger, 2-thumb encircling hands, or the heel of one hand.
All right, for the essence of time, if you can just turn that light on for me. So here's what's going to happen. So I wanna make sure it's clear with you all. The infant was choking, right? You went like this, and you tried this 5 times, you tried this, and so you saw the infant, they just went out. So for the adult, we put them on the ground. For the infant, we can put on the ground. But in this scenario, it's easier for us to put on a raised platform, okay? Tap the feet. Hey, can you hear me? Can you hear me? Hold on, I want to get the AED. It's very rare that you use an AED for an infant, right? It's respiratory in nature. Just tell anyways, you're going to check for breathing. You're going to look, and then the 3 ways will what? 2 fingers. What else? The thumbs. 1 hand. All right, for each table, whatever the case may be, right? I want you all, this is what's going to put this sound in the background, and all I want you to do is practice. Okay, just do it for like 15 minutes, 15 seconds, 30 seconds. Try it this way. Yeah, 15 minutes is a long time. Right? And when you do the encircling one, turn the feet towards you, and then reach under, and then use your 2 thumbs. Okay? Now, before you do that, I'm going to ask, and then if you want to go take we'll do and get ready for Salah. Is there any questions for me before we do this? Because this is where we'll end. Yes.
If someone's choking or sitting in a wheelchair, should you push them a little bit?
You're going to, yeah. Yeah, so the question is, look, what we did with Azad, you might have that, because you have different types of wheelchairs, you might have to get around them, but I would still probably say I would do the seatbelt technique where it's this, and they're gonna be like this. It's gonna be uncomfortable, but you do the best you can. By the way, someone who's tall, for choking, get them to both their knees, like this, and then you're gonna do the same thing that I just showed you with Azad.
So you gotta ask the baby, are you okay?
You don't have to ask if you're okay, but you can still tap them and just call their name. It's a very good question. Good job. All right, any other questions for me? And I can also be available for you afterwards. Does anyone have any questions at all before? I mean, and if we can end in 5 minutes with this, I can still be here. But if you do want certifications, talk to Azad. We need first name, last name, and email for those who've been here for the class. And then I can give you those, and then there's, like I said, the costs, so we'll talk about that. So what I want right now is for whoever has a mannequin, I want you all to stand up. I'll show you the first thing I want. So whoever's the mannequin, stand up for a second. Put the mannequin perpendicular so it's like this in front of you, okay? Stand up for me, stand up, stand up, stand up. Turn the little button on, that's on the little diaper part, okay?
Trying to give you some skills.
So, do me a favor, I'm just gonna take one last thing. The airway for the infant, what's that kind of thing? The airway for the infant is the size of the infant's pinky. It is very small. So, with one of your hands, hold the head here, not under, not on top, but just hold it so it's in a neutral position, okay? Put 2 fingers in the center of the chest, okay? 2 fingers. You want it this way, not this way. So if you need to step a little bit to one side, and I want you to start pushing with 2 fingers, okay? Okay, very good, sister, if you want to.
Yeah,
turn the head so it's
there
on
you
the
go.
other
Very
side.
good. Good job, man.
Very good. Keep going. Keep going. All right, do me a favor. I want you to try the heel of your hand. Try the heel of your hand. All right, turn the feet towards you and put your thumbs on top and your hands underneath the torso and push as well. Go ahead.
This is kind of making me want to be
There you go, man.
All right, very good. Everyone feels comfortable? Pass it to the next person. Someone else stand up.
Go for it, man. Switch your room.
Okay? I don't care which technique you want to try. You want you to try all 3. If you want to start at the wraparound, start at the wraparound. Just make sure you try the heel and try the 2 fingers. When you're done, pass it to the next person. We should go over to this one. Not so hard, not so hard, she said, way too hard.
Yeah, Mem sisters are rough, bro. Oh yeah, good green.
When you're done, pass it to someone else. What's his name again?
Abdul Basit.
Oh, wait.
Yeah.
Thank you for attending.
That's Rashid's.
You know, from way back then.
Well, I'm sorry, bro. I'm sorry, man. Oh, this shit is great. Sisters, before you go, or anyone else who does not know where this is, who knows where this belongs? Abdul
Basit.
You done? All right, sisters and brothers, Jazakallah khair. You keep on going, whatever. If you want, whoever wants to know where your AED is, Abdul Basit is going to walk downstairs and show you where it is.